recognize my good friend from Ohio, Representative Greg Landsman, for his 5 minutes of questions.
Thank you, Madam Chairwoman and Ranking Member DeGette, for today's hearing on the use of AI in our healthcare system. Obviously, as we've heard, there are so many opportunities to improve care and to lower costs. There are also enormous dangers associated with this, and I want to talk about the Medicare piece and this potential new program that the administration has announced. Because Ohio is one of the states. So this is urgent for us, and I want to make sure that this committee, which I think will appreciate the need for some bipartisan pushback and guardrails here, will act, because it is going to be our seniors in Ohio and in Texas and the other states that may get hurt, and we don't want that to happen. But as you all know, for decades, tens of millions of Americans seniors have paid for and relied on Medicare for their health care needs. The administration announced this new effort that will require pre-authorization, pre-approval for procedures under Medicare. And it's been referred to as the AI death panel, in that you're taking what private health insurance companies do now in terms of denying care that ultimately leads to the loss of life, and you're handing it over, as I understand it, to a tech company that is going to use an AI model that has not been vetted. And to make matters worse, the incentive is there to deny the claim. You get more money if you're that AI tech company, if you're able to deny more and more claims. That is going to lead to people getting hurt. And I do, again, think there is a bipartisan desire to ensure this doesn't happen. The doctor and the patient should determine what care is needed, and we all agree on that. And while AI could provide some additional insight, I think, Dr. Mello, you talked a little bit about what needs to happen, but I wanted to get your thoughts on the legal, moral, and health challenges that this new program creates.
As you pointed out, the reimbursement model for these tech companies really stands the concept of shared savings on its head. You know, shared savings evolved in the Medicare program to give healthcare organizations incentives to take better care of people, and then when they got better, if they saved money on expensive procedures, the healthcare organization got to save that money. This is flipped. Now they're going to make more money by denying care. And yes, there are safeguards there, procedural safeguards to prevent the worst abuses. But that is a very weird reimbursement model for what they're trying to do here. The other thing I would point out is there is some political genius in the architecture of this program, in that they have chosen to begin with a small set of procedures that most people who do what I do for a living and assess health services would say, we're providing too much of. They are expensive, and there's a very thin to no evidence base. The question is, where does this program go in the future? And the problem is going to be that we don't have national coverage determinations to expand it in ways that can protect beneficiaries.
Yeah, until we have those answers, until we have those assurances, I think the pilot should be stopped, and hopefully there'll be support to stop it. Because you mentioned, and I want to just do this very quickly, and others have agreed or reiterated, that there should be disclosure of the product, full disclosure of the products being used. Seems smart enough. That there's full vetting of those products, that an independent review board and maybe the Joint Commission, as you mentioned, can serve as that review board, deal with the liability questions, and ensure that this doesn't touch, quite frankly, anything that could harm patients. And until we have that, I think the program should be shut down. And I'll help lead on that. Sorry, my time ran out.
Okay.